So for those who don't know me, I'm Sarah, dietitian at Great Ormond Street. I've been in the service since we started, so I've learnt a lot over the years from all of the families that I've worked with. What I thought I'd do, once I've worked out the technology, is just do a quick overview of what I'm going to do. Then we'll have a quiz, because then I can relax and look at the screen, make sure I know what I'm doing. Do a quick recap on diet and BBS. Think about what's new in clinics. See if we can find some easy wins, and then tips to get the most out of your appointment with the dietitian. So the first quiz question, how much should a 4-year-old eat? And we're going to do it by a show of hands. This is something I found in my freezer, so don't look at the food that closely. So it's pasta bolognese. It's all the same size plate. The vegetable portion is the same on each plate, just to make it more obvious how much food's on the plate. So who thinks a 4-year-old should eat option A? Nobody. Okay. Who thinks option B? Is that pretty much everybody? Okay. And then who thinks option C? Oh, well, I think I'll just go home. No, but more simply than this, it's really tricky to feed any child. So if you looked at sort of guidance, the Infant and Toddler Forum publish guidance on what toddlers should eat. And they would say 3 to 5 tablespoons of pasta with bolognese. And that really is option C on the slides. Option A is too big. Option B is slightly less than that 3 tablespoons. So it's hard, it's really hard to feed children. It's hard to know. There's not even a sort of set amount. We go, here we go, feed your child this, and it'll be great. Next quiz question, but you're all doing so well. I might give up. Okay, I'm hoping to catch some people out, but it's not looking like it's going to happen. So how much activity should a toddler do a day? I've got it in minutes and hours, so option A, if you fancy that one, 60 minutes. Okay, this is already looking better because we've got different answers. Option B, 120 minutes or 2 hours. Okay, that's the biggest number in the room. And who thinks option C? Okay, so the answer is actually option C. Toddlers should be active for 180 minutes, 3 hours a day. And that sounds like a massive amount, like 3 hours. But exactly. Toddlers don't stop. And it doesn't need to be 3 hours and a go. You're not going to go, right, come on, let's go. It's every little bit of activity that counts towards that. And it's lots of different activities. So it's playing with toys. It's, walking, scooting, whatever they might do. So, right, that's quiz time over because I'm relaxed. I know how to function. Okay, so thinking about diet and BBS, which I know you all know about. So I thought I'd do a quick recap in case there's anyone new. So we know that those living with BBS have lower energy requirements. So your child will need less than their friends in their class. So that's the first bit that makes it hard. The second is hyperphagia, that we've heard about a lot today. So that's the excessive hunger and also the food-seeking behaviours. So if you need less but want to eat more, it's really hard. We also know that energy requirements, like for all of us, vary. So no child I see in clinic needs the same amount as the next child I see. Limited dietary range is a huge issue for lots of the children I see. And so diet advice needs to be individually tailored for every child. Thinking about weight in BBS, we know from the literature about 72 to 86% of adults are living with obesity. There's less data published for children, but there's a paper from 2021 that shows from the age of 2, 70% are living with obesity. And that already makes you think, this is impossible. And I'm hoping to sort of share that it's hard, but it's still really worth trying. So we've got some data from GOSH on the slide, and that's really to show that increasing BMI isn't inevitable. So we have about 9–10% of our children that maintain a healthy BMI. And not all of those children have always had a healthy BMI. They were higher and have reduced, but it's incredibly hard. But the more exciting thing is that about 60% reduce their BMI between appointments. And that's definitely the same for our data last year that's not yet published. But what else makes diet in BBS, or diet in general, really hard is the food environment we live in. People eat anywhere, anytime. We can press a button on our phone, we can get, Uber Eats, delivery, whatever. There's food in spaces that traditionally were safe spaces to go. You go to the park, there's now a cafe or a pop-up little truck. So, you're taking your child to do some activity, but there's the ice cream van, there's the coffee truck. It's hard. We lead busy lives. So food and food planning is hard. There's lots of people living in houses with lots of different people in the house, eating at different times. We eat when we celebrate. The way we deal with food, it also depends on how we were brought up. If when you fell over, you were given a biscuit to make you feel better, that is probably what you want to do as a parent with your child. And the other thing that makes food really hard for children with BBS is our new open plan living. So if you're downstairs in my house, you can see the kitchen wherever you are, which means food's there. And if I know there's something hidden in my kitchen that's nice, it's not that hard to go and get. But now think if you're a child that constantly feels hungry, how much harder that is. So I wanted to do a little bit about hyperphagia. So when I started, there was only one paper specifically about hyperphagia back in 2013 that showed more than 90% of parents reported their child was interested in food, more interested in food before 5 years of age. But there are 2 brilliant papers now written by Elizabeth, who's in the room. And if you have healthcare teams that don't understand the impact of hyperphagia, I would recommend showing them these papers so that they read them. So what it shows is that the most common behaviours are 90% of children are negotiating for food, and about 90% are waking up or asking for food in the night. Now that's really hard. We also know that families are working really hard to control their child's weight by using 8 different strategies to manage weight. That's huge and hard. The other big take-home message for me was more than 70% of caregivers from the UK reported their child's sleep, because of the hyperphagia, was affecting them to a moderate or a great deal. Now, I know I didn't sleep that well here last night, and I know how good I perform when I haven't slept. But just on a day-to-day functioning, how I eat, everything goes out of the window. So it's really important to let us know if that's happening for you. And it will be happening for most of you in the room. Now, I know you know this, but I wanted to put into context how many strategies you're already using if your child has hyperphagia to manage it. And this isn't extensive, so you can come and tell me any other tips at the end that you use. You might need to constantly supervise your child. That's really hard. You might be locking food, you might be hiding food away, you might be using a visual food timetable, you might be thinking about how you shop, you might be menu planning, using distraction techniques. You might be using vision changes to spread food about the plate. But I think all of you will be thinking one step ahead all the time, so that you can think about food when you're here, food for the conference this weekend, if you're doing an event, it's just huge. It's the focus of lots of your energy every day. And we acknowledge that as a team, but I want to make sure that you will realise how hard you're working on a daily basis to manage this. So we did a survey just before Christmas to look at the impact that hunger and food behaviours were having for our families. So I'm really grateful, as ever, for the number of responses we had. And it's been really interesting to see this. So about 80% of our families reported their child had had excessive intake at some point. And this typically started before the age of 4. So 74% reported that started before the age of 4. So quite early, particularly those that started before the age of 2. Now, I wanted to look at the impact of food cravings. And what this slide shows is for all of our families, remembering that their child has never experienced hyperphagia, and some no longer have hyperphagia. So in that group, 66% say their child's food cravings has an impact on their life. If I did this for all the children, for the children still having hyperphagia, the pie chart would be 100% of those children are impacted by their food cravings. And so there'll be numbers on the screen, and I'm going to talk about different things. So for the kids with hyperphagia, just under 50% have their food cravings have a daily impact. And for 20%, 1 in 5 of our families, that has a massive impact and might stop them going out. It might stop them attending family events. So it has a massive event on lives. And we just need to acknowledge how hard families are working and how hard this is for the children too. So we talked this morning a little bit about hyperphagia and that we have tools. It's really difficult to measure hyperphagia. We all have different ideas about how much somebody should eat, how much. It's really difficult to find out if someone feels hungry, if they've always felt hungry. And a lot of the work has used questionnaires that have been designed for another condition. So you might remember at the last conference, you were asked some questions. And we've used those questions to develop questionnaires that we're now using in clinic. So thanks for all of that input, because it's helped us produce tools that are producing useful information. So we now have 2 questionnaires that are in use in both clinics, both at Birmingham and Great Ormond Street. So there's one that the parents and carers fill in, and there's one that young people can fill in if they're over 11 and it's appropriate. And we're probably using them slightly differently at both services because they're being rolled out, but they will be in use in both clinics. The really exciting thing is that they're now available electronically. I'm so excited, it's taken a long time to get this far. And this isn't real, this is test data. So if you attend Great Ormond Street, you will see them in this form. If you go to BCH, it will be coming soon when you swap to this electronic record system. So the top one in green is the view you see if you fill it in clinic, and the bottom one is the view you'd see if you're filling it in through the My Chart app. I haven't put all the questions up because that would take too long, but the really exciting thing is that if you're filling in the questions now, there are certain questions that you answer yes or no, and then it takes you through to different options rather than you having to read a whole heap of information. And it means the questionnaire is scored automatically, so I don't have to add it up anymore. So it's going to be definitely right. But it's stored electronically, which means we can see this data. And the next slide shows, this is again test data, that we can see, and we'll be able to show you in clinic, once we work out exactly how to access this, how it's changed, how hyperphagia has changed for your child, but we'll also be able to put all of this data in the registry and be able to look for patterns and see if we can find out some useful information to share with you over time. So, this might be too late for lots of you, but there's some ways that are useful to support your child. So if anyone's got a younger child who's about to start school or nursery, talk to the team about diet in BBS and about hyperphagia. And you need to do that even if your child has never shown any inclination to take extra food or get extra food. Because when you're at home, particularly with the first child, well, I'm thinking of me as a parent, they were always there and I had total control. And it's not the same with other children, but you can control exactly what that youngster's eating. When they go to nursery or school, it might be the first time they get to take extra food. And it's often done by taking food from a child in the playground that's a little bit slower eating that cake or biscuit, and then your child is labelled as naughty. They're not naughty. They're just seen an opportunity to get some extra food and taken it because they're hungry. It's important to think about how food is handled in school. You need to talk to your child about any different food-related event, because for some of our kids, if you eat lunch out, as soon as you get home, they might want food again because that's what's happened. You need to try and talk to family and friends, but it's incredibly hard to get anyone to understand, because we all know if we go to a party or a picnic, we all eat more than we normally would. So it's really hard for extended family to understand the impact this has for your child. We've heard a lot about independence, so I'll skip over that. But the one final thing that's important is to share information with your child about their diagnosis when it's appropriate, in an age-appropriate way, so that they understand about the hyperphagia that they're feeling and don't end up feeling guilty that they're eating more than someone else or not able to control their appetite. So that's hugely important and something that we can miss if they don't understand that steps. So quickly moving on to some easy wins that aren't easy, but hopefully one or two of them might work for some of the kids in the room. So we've heard lots about sleep, so I'm going to just highlight that if we don't get enough sleep, our food choices change. We want higher energy foods. That's the same for us making the meals and for the child. So do chat to your healthcare team if sleep is an issue for either your child or you, because you're up with your child. It's good to think about drink choices, because we eat the same amount of food, whatever we have to drink. So you can serve the same amount of food if you can alter the energy content of drink choices. So lots of drinks we consider as healthy, things like fruit juice and smoothies, contain more energy than we think and are typically the same as any other fizzy drink. But if you look at it the other way around, you wouldn't. So a 250 ml bottle of fruit juice is the same as 2.5 oranges. I can't eat 2.5 oranges at a go. I could definitely drink 250 mils of fruit juice. But you can save energy by offering water and eating an orange. This is then the other thing. Again, this isn't a child-friendly meal necessarily. I'm sure there's, but I eat. I love lots of different foods that make it look interesting. I want a full plate of food when I'm offered food. Otherwise I feel shortchanged. But I want you to have a look at these two pictures and have a think about how many calories are in each meal. And you'll be able to see some differences between the two meals. But I'm hoping I'm going to surprise you with the calorie difference. So when you look at it, the meals are really quite similar. There's just a little bit less avocado in the picture on the right. It's got less carbohydrate hidden under more salad, and the fat was taken off the meat. But by making little tweaks with food, we can still give a full plateful that looks great, will fill us up, but we can save some calories. So in practice, that would be things like using smaller plates. Our plates at home will be much bigger than the plates when I was growing up, and they hold, that 7 centimetres holds about 20% more food between the two different plate size. If you've got smaller children, use their hand as a portion guide. So a palm is for protein like meat or fish, the fist for carbohydrates like potato and rice and pasta, and the cupped hands for vegetables and salad. This is my favourite for anyone that sees me in clinic, is using the half a plate method. And this works really well for children that like vegetable and salad. But there'll be lots of you that this isn't going to work for at all. The thing I like about this is you can do it anywhere. And if you start it young, it should be continued for life. And the way it works is that the plain vegetables have less energy than the protein or the starch that it replaces, so you're saving energy at every meal. I thought I'd talk quickly as I fly through about activity, because this is challenging as a parent. So it's useful to build small amounts of activity into every day, so it's just part of your child's life without it being exercise time. It's really important as parents that we lead by example and they see us enjoying active time. It's much better to make activity fun rather than exercise. Again, it's much more likely to work. But like for anything we do, like changing diet or becoming more active, we need to do it slowly. It's useful if we can make it a shared activity or a family competition, because my children like to beat me at everything. The other good tip is to look on your local offer, on your council's local offer page for accessible activities. And there are also brilliant 10-minute shake-up games on the Healthier Families website. They are Marvel and Disney inspired. You need to look at them without your child, because some of them need lots of people or lots of equipment, but it's then a useful start to fit 10 minutes into a day, particularly if the weather's nasty. So just to fly through, to finish off, this is, I love an infographic. This is the UK Chief Medical Officer's one for children. We should be doing 60 minutes of activity for school-aged children, and the message is really about getting strong by moving more. But the key again is spreading the activity through the day. Now for some of you, that might feel a really hard target for your child. So there is a newer infographic for disabled children and disabled young people that might not be able to achieve 60 minutes a day. So it's really important to remember that you get health benefits from 20 minutes of physical activity a day. So if your child can't do 60, aim to increase to 20 and build it up from there. But remember that those 20 minutes will be having really positive impacts on their health. And the key message here is finding something that's fun and exploring activities that make you feel good, which, you know, is the activity that any of us want to do. And finally, tips for getting the most from your clinic day. It's a long day in clinic, as you know, and the appointments are relatively short with each clinician. So it's really useful if you can complete the diary that's sent out beforehand. And I know both Birmingham and Gosh send out a diary. Tell us what you want from your appointment with the dietitian. So you know your child best, you know what you want to find out about, so that we can make sure we cover that in the time. It's really useful if you come with a list of questions or concerns, but also the things I like to hear best are the tips that you have found useful, because those are the ideas that I then share with other families. So it's great when somebody comes back and says, you talked about, but that wouldn't work for Harry because this or the other, and this is what I did instead, and this is what's happened. And then when I hear from another family that say, no, that won't work because of this, I think, aha, I remember. And I say, well, you could try this. And that's how we've built up information over the clinic period. Bring with you contact details for your local team or school if you want us to contact them. And at GOSH at the moment, face-to-face appointments are every 2 years. So come and think about any big life event that's going to happen in that time, starting school. There's loads of things that might happen. But come with that information and we can see if we can discuss it. But also, if you go, well, 2 years' time, we're going off, whoever's going off to secondary school, see if you can message me and we can make a time to chat so that we can talk through it before you hit that time. Remember, we are there between clinic appointments. We do work. And so if you have any queries, send us a message. And at GOSH, that's by contacting the BBS clinic team or My GOSH. You can also ask for a referral to a dietitian nearer to you if you want more support in between.